So let's discuss the questions of dermatology. The first question is this. All of the following are the cells of epidermis except keratinocytes, melanocytes, mast cells, and Merkel cell. Please remember, the mast cell is not the part of your epidermis. It is the cell which is present in your dermis. So in your epidermis, we have total four type of cells. One is known as keratinocyte, which is present in majority, 90%. We have three more cells: Merkel cell, Langerhans cell, and melanocyte. Melanocyte is our pigment producing cell which is located in stratum basale. Your Langerhans cell, it is a immune, it is the first line of defense or immune cell which is located in your stratum spinosum. While Merkel cell is the touch receptor which is again located in stratum basale. Mast cell is a cell of your dermis. So let me show you the image. This is your epidermis. You can see that melanocyte is present here. It is a dendritic cell. The next is your Merkel cell. Again, it is a dendritic cell. These are your keratinocytes. So these three cells are present in the stratum basale of the epidermis. The Langerhans cell is present in stratum spinosum. All the other keratinocytes, they are arranged in 5 layers: stratum corneum, lucidum, granulosum, spinosum, and basal. But mast cell is located below the epidermis, that is in the dermis. Second question was, school of fish appearance is a feature of. In which condition you see a very classical school of fish appearance? Please remember the correct answer of this question is option number 1, Haemophilus ducreyi. The school of fish appearance is a feature of Haemophilus ducreyi. Okay. Now, what is Haemophilus ducreyi causes? It causes a disease which is known as chancroid, which has multiple painful ulcers, and it has associated painful lymph node enlargement. Lymph node enlargement is also seen. So this is your chancroid. The other features is the lesions, they are soft to touch, and that is why they are known as soft canker. When you do a gram stain in these individuals, you see a very characteristic, a grouping of these bacteria, which is known as school of fish or railroad track appearance. The drug of choice here is ceftriaxone and azithromycin. The drug of choice is ceftriaxone and azithromycin. This is the very classical school of fish appearance. You can see the grouping of these cells. You can also see that they are arranged in the linear colonies like railroad track. So this is your question number 2. Moving to the next question, the chemical agent responsible for chemical leukoderma caused by adhesives present in the bindi. Please remember, the adhesive which is present in the bindi is para-tertiary butylphenol. Para-tertiary butylphenol, which is known as PTBP. Now let me show you the image. This is the image when somebody applies bindi for a long time. He develops or she develops allergy to it, and because of allergy, ultimately there will be a complete loss of the pigmentation. Patient can even go into the leukoderma status. Okay, so this is your bindi adhesive. Let's discuss some more allergens. So we have PPD, which is paraphenylene diamine. It is a feature of hair dye. This is paraphenylene diamine. It is a feature of hair dye. So if somebody apply hair dye, you can see the lesions on the neck, on the face as well. Then Parthenium due to plant, you can see Parthenium dermatitis. This is a very classical Parthenium plant which is also known as Congress grass. And the allergen present is sesquiterpene lactone. The allergen here is usually the it is through the bloodborne. So it is a very classical bloodborne, airborne, not bloodborne, very classical airborne infection or the allergen which spread through the air. Next is oral pink fluorescence in the groin region on the Boots lamp examination is a feature of. Answer is erythrasma. Erythrasma, it is an infection due to Corynebacteria minutissimum. When you see it under the Boots lamp, you see a very characteristic coral red appearance, something like this. If you see this, this is a very characteristic coral red appearance of Corynebacteria minutissimum. In your exam, they will also ask you the other causes or other Woods lamp finding. So the infections or the diseases And what is the Woods lamp finding? You should know about that. The disease is vitiligo. You get a very classical ivory white or milky white appearance. Pseudomonas infection, you get a green fluorescence. Then we have Corynebacteria minutissimum, which is erythrasma. You have a coral red appearance. You have a coral red appearance. The next is Pityriasis versicolor. It is yellow. And tinea capitis. It is tinea capitis is a dermatophytic infection, and this is your blue-green fluorescence. So these are some of the fluorescence findings which you need to know for your exam. Okay, you need to know these findings for your exam. Now coming to the next part, the last question, the characteristic feature of atopic dermatitis. Please remember, for labeling a patient to be a patient of atopic dermatitis, the must thing is presence of itching. Pruritus is must. If pruritus is not present, if itching is not present, you can clearly rule out the diagnosis of atopic dermatitis. So the answer here is option number 1. And with this, we are done with the questions of